Selected Metro Manila cities rolled out Sputnik V COVID-19 vaccines. Manila, Taguig, and Parañaque kicked off the pilot run today, noting long lines outside the vaccination hubs. Those areas, including Makati and Muntinlupa, received 3,000 doses each, given the transport and storage concerns. Only 15,000 doses arrived in the country from a government purchase of 500,000 of the Russian-made vaccine. Let's speak now with the medical director of Santa Ana Hospital, one of the facilities that rolled out the Russian-made vaccines. Dr. Grace Padilla joins us now on The Final Word. Doctor, thank you so much for joining us. Ilan na po ang
yes,
nabakuna?
Good evening, everyone.
Ilan na po ang nabakuna? How many have been vaccinated with the Sputnik V vaccine at the Santa Ana Hospital?
Yes, it's been a big day for the frontliners today. We vaccinated around 165 frontliners in our city.
And doctor, was this better than expected? Did you expect less, or was this in line with the numbers that you were expecting for this Russian vaccine?
Yes, initially low lang yung aming expectation, but surprisingly, we received 165 frontliners willing to be vaccinated with Gamaleya or the Sputnik V vaccine.
All right, 165 frontliners have already been inoculated with their first dose of the Sputnik V. Did any of the 165 have any kind of side effects after they were immunized?
Well, based on the report, we do not have any adverse effect after inoculation. So there's zero effect on them. Yes, there's no zero. No report.
So 3,000 po, no? 3,000 ang binigay sa inyong mga bakuna from Sputnik V. You already have 165 today for the first dose. Kailan niyo po matatapos ang 3,000 doses sa Maynila?
So yes, the plan is we add on another vaccination site, which is the Hospital ng Maynila. And we are planning to roll the vaccine in a week time. So sana maubos namin yon.
At kailan po darating yung second dose of the Sputnik V? And what should be the interval po, Dr. Padilla, between the first dose and the second dose?
Yes, yesterday we have received the first dose or the first component of the vaccine, which is the adenovirus 26 carrier. So that's the first dose. And then after 21 days, we're expected to receive the second dose, which is a vaccine having the adenovirus 5 carrier. So the vaccine also comes in two forms. It's frozen and it's in liquid form. So what we have received is the frozen one, which requires a storage refrigeration of -18.
So the second dose, Doctora, has to be injected on the person after 21 days. That's 3 weeks. Have you been promised by the government that you will receive the second dose within 21 days?
Yes, they assure us that the second dose will be arriving before the 21st
That's good to know, Doctora. Tell us now about the COVID-19 occupancy rate at Santa Ana Hospital. Currently, you have a 300-bed capacity. 150 have been basically assigned for COVID beds. Are all of these COVID beds being used up? Or are you fully occupied?
We have a 50% occupancy rate now at around 79 inpatients. So as mandated by the Department of Health, we need to allocate 50% of our beds for COVID. So that is 150.
Okay, so wala pong
50%, meron pa po.
So wala pong naghihintay ng mga COVID-19 patients sa emergency room at sa mga tents and even in their cars, because this was the bad experience, the nightmare that many hospitals experienced over the past 3 weeks.
Yes, and we do not want to experience that again. So we really strategize on how we can accommodate them in our facility.
So sa palagay nyo, Doktora, with only 79 COVID beds occupied out of 150, should we remain where we're at? Should we remain at MECQ to further bring down the number of infections, or should we further open up the economy after May 14?
No, 79 is a big number. So we need to continue what we are doing right now. And I think this is effective, no? And continue to be on MECQ.
Maraming salamat po for joining us on The Final Word. Dr. Grace Padilla, the Medical Director of the Santa Ana Hospital.